Hi Matthew, how are you today? My name is Nina. I'm going to be doing your assessment, okay? We're going to be assessing your scalp, your head, your eyes, your nose, your mouth, your neck, and then we're going to end with your respiratory and cardiac system, okay? All right, lovely. All right, so using my pen, I'm going to go ahead and check this scalp for hair distribution, which already along the hairline I see is normal. It's even. I'm parting his hairline just to make sure that there are no lesions along the scalp. Trying to maintain it at about 1 centimeter. Parting. I see no signs of lesions. The patient seems not to have any signs of tenderness or pain. The right side seems normal. Moving on to the left. Again, trying to keep the same distance as far as parting goes. Again, looking for lesions. No signs of lesions. And while I'm here, I can always look behind the ears. Skin behind the ears, it seems intact. No signs of erythema or lesions there. On the right side, again, no signs of erythema. Skin is intact. With my hands, I'm going to palpate the scalp. Feeling for symmetry. Any signs of tenderness from the patient. Making sure I didn't miss any lesions. You okay? All right, so scalp seems normal, intact, symmetrical. All right, Matthew. All right, at the patient's eye level, I'm gonna just go ahead and check your mouth, okay? Already I see there are no signs of lesions at the mouth or lips. They are pink, which means good perfusion. Open your mouth, thank you. With my pen light, I'm gonna go ahead and look inside the mouth. Look up a little bit, thank you. And I apologize, I have no gloves today, but this is my son, so I trust you. Okay, no signs of lesions. Inside of the mouth, at the gum line, everything seems intact. Looking up at the glands. Okay. The hard palate is intact. If you could stick your tongue out for me. Thank you. Relax. No signs of lesions along the tongue. Can you lift your tongue up for me? Sublingual glands are intact. Okay, Matthew. At this point, I want to look at the back of your throat. So if you could just tilt your head up a little bit, a little bit. Okay, relax. Stick your tongue out and just say, ah. One more time. All right, I see no signs of erythema. One more time. The uvula is midline, and the tonsils are at a measurement of 0. Okay, you all right? Mm-hmm. Okay, while I'm here at the neck, okay, I just want to make sure that the trach is midline. It is midline. Just going to go ahead and palpate the carotid artery. One at a time, making sure it is palpable, and it is. Move over to the right. Carotid artery is palpable and regular. Okay, I'm just going to move behind you. I want to check your thyroid. Sit up straight for me. Using my landmarks, looking for the thyroid. Okay. Just pressing slightly firmly, not trying to choke the patient. Can you swallow for me? Any pain? Swallow one more time. And it's even on both sides. The thyroid is normal. Okay, Matthew, so we've checked your neck, your throat, okay? Gonna move over to your ears now, all right? Okay, now already, there are no signs of erythema on the outer ear, the pinna, the tragus. Just wanna go ahead now and look inside the ear canal. Okay, can you look over to your left for me? Pulling the pinna up and out. Okay. I see no erythema within the ear canal. Tympanic membrane is pearly gray. Translucent. No signs of tenderness on part of the patient. We're going to move over to the left side. Again, you're just going to look over to your right. No signs of erythema or abnormalities, lesions at the ear, the pinna or tragus, pulling the earlobe up and out. Ear canal is clear. No signs of erythema. Tympanic membrane is gray and translucent. Good. Now while we're here, okay, I'm just going to check your sinuses, all right? Using my light, I'm looking for transillumination. I have to dim the lights first to make sure that I can see this clearly. You all right so far? Good. You can just relax your face. You close your eyes if you need to. Transillumination is good on the left. Good on the right. Now I'm going to check the sinuses for transillumination. Open your mouth. Transillumination is good on the left and on the right. Okay, while I'm here, I'm just going to look inside your nose. Sorry. Just going to press up a little bit. Okay, the membrane looks intact. I see no signs of discharge. No erythema, no occlusions, no lesions. Okay. All right, I'm going to put the lights back on for a minute. Just going to feel around on your sinuses, see if you have any pain. Anything?
No.
Good. So upon palpation of the sinuses, there's no signs of pain. Okay, I'm just going to tap lightly on your sinuses. You let me know if you feel any discomfort. Anything?
No.
Okay, so his sinuses seem to be clear. All right. Now we're going to be moving over to, actually, I didn't look at your sclera. So I'm going to go ahead and I'm just going to backtrack real quick. I want to make sure there's no discharge at the eyes, okay? So I'm going to pull down here on your eyelids, look up. Everything looks pink. No signs of discharge. At the conjunctiva, the scleras are white. I'm going to pull up this time. You're going to look down. Scleras are white. Look to your left and look to your right. Everything normal at the scleras up top. Okay. Sorry about that. All right. So we did your eyes, your nose, your throat, your head. We're going to be moving now over to your respiratory system. Okay. So at this point, I'm going to ask that you take your shirt off. Okay. All right. Okay, so already I'm going to be looking at your skin. The patient's skin is intact. I see no signs of bruising. Lift your arms up. Posteriorly, skin is intact, no signs of bruising. Okay. All right, so I'm going to go ahead and just take a quick listen to your lung sounds. Okay, and before I do that, I just want to check something called tactile firmness. When you feel my hands against your skin, you're going to say 99, okay?
99, 99, 99.
Tactile firmness is normal anteriorly. Same thing on the back. When you feel my hands, you're just going to say the words 99.
99, 99, 99, 99.
Good. So tactile firmness is even bilaterally. See no signs of abnormalities. I'm going to go ahead and just listen now, okay? When you feel a stethoscope against your skin, you're just going to take a deep breath for me, okay? Sit up straight. Thank you. So beginning at the top of the lobes, I'm listening. Clear. So far anteriorly, the lobes sound clear. Can you lift your right arm up for me? Listening to the middle lobe, laterally. Now the lower lobe laterally. Lung sounds are clear on the right. Moving over to your left side. Just lift this one arm up, mid lobe. Lower lobe. Okay, lung sounds are clear as far as laterally goes. Now I'm going to listen posteriorly. Again, you're just going to take deep breaths, okay? Moving in a symmetrical formation so I don't miss any lung sounds. Any differences in the lung sounds? And as I move my stethoscope from side to side, I want to make sure I'm not over the scapula. Okay. The lung sounds are clear. I don't hear any wheezes, any bronchi or rales. Okay. All right, so next I'm just going to move over to, I'm just going to do some percussion, tapping on your chest and on your back to make sure everything is equal, okay? Ready? Okay. Up. Now on your back. Okay. Percussion sounds are normal, both anteriorly and posteriorly. Now I'm just going to check the diaphragmatic excursion, basically just the size of your diaphragm, okay? You can just breathe normally. When I ask you to take one deep breath, you're going to hold that one deep breath for me, okay? You ready? Take a very deep breath for me. Hold it. So I got a difference of about 3 to 4 centimeters, so that is normal for the diaphragm. Okay, you all right so far, Matthew?
Yeah.
Okay, great. So now my cardiovascular assessment I can do while you're lying down, on the supine position, okay? Move back a little bit. You're gonna lie down for me. I'm gonna use this chair in front of me just to bring your legs up. Okay. Is that comfortable for you? Okay, great. All right, so again, I've already checked the skin previously. Skin's intact. As he's laying down, I don't see any extra pulses or along the chest line. It's symmetrical, okay? All right. I'm gonna go ahead and listen to your heart sounds now, okay? I'm gonna begin with my diaphragm, and then I'm gonna go back around with the bell to listen to any low heartbeat sounds. Okay, ready? So I'm looking for the second right intercostal space for the aorta. The aortic valve is normal. Okay, moving over to the left second intercostal space for the pulmonic valve. That's normal. Third, Erb's point. Also normal. Fourth, mitral. That's normal. And moving into the fifth intercostal space, midclavicular line for the apex. That's normal as well. I hear all normal lung sounds, S1 and S2. Now I moved my stethoscope over to the bell. Again, listening for any missed low heart sounds. Starting again at the aortic valve, second right intercostal space. That's normal. Moving over to the left, second intercostal space for the pulmonic valve. Also normal. Third, Erb's point. Normal. Mitral. And then just checking the apex at the fifth intercostal space, midclavicular line. audible and also normal. I hear no extra S3 or S4 cardiac sounds. Now, I'm looking along the abdominal wall here just to see if there's any distension of the aorta. I don't see any. While I'm looking, I'm also palpating for signs of tenderness. The patient doesn't seem to be in any sort of pain. I'm going to go ahead and listen to the aorta, followed by the renal arteries, iliac, and femoral. Okay? You can breathe normally. Okay. Now, Matthew, I'm just going to pull your shorts down slightly. Can you lift your hips? Thank you. Okay, making sure that the patient maintains covered. I'm listening to the femoral arteries. Okay, so the arteries do sound normal. While I'm here, you're gonna feel my hands. I'm just checking for your femoral pulse, okay? It's palpable, normal. Onto the right side. Palpable and normal. While I'm here, I'm just gonna check the JV for distension. I don't see any distension at the neck at the jugular vein site, which means that's normal. Okay, moving down to his lower limbs. Okay, I already see that the skin does seem intact. Lift your leg up for me. Okay, I see no sign of skin discoloration. Hair distribution seems to be also normal. Okay, while I'm here, I'm going to check your popliteal pulses. That's behind your knee. Can you bend your leg up for me? Thank you. Right side is palpable and normal. Thank you. Left side also palpable and normal. Moving on to the tibial pulses, just here at your ankles. Those are palpable and normal. Dorsalis pedis pulses. Palpable and normal. While I'm here, I'm going to check capillary refills at your toes, okay? Left side is normal, less than 3 seconds. Right side is normal, less than 3 seconds, okay? Can you sit up for me? Sorry. Okay? All right, and just one last thing, I want to look at your fingernails. Again, just for capillary refill. While I'm here, I can also check for signs of clubbing, which for Matthew, I see no signs of clubbing. It means good perfusion, both for your vascular system and you're getting enough oxygen. All right? Do you have any questions for me today? Okay, thank you.